A very good day to my Dr. Chi1. Today our group 19 going to present about how fecal, short-chain fatty acid and occult build help diagnose gut health and metabolic disorders. There are five outcomes which are objective, introduction, procedure or methodology, target output, and effect on well-being and organism. Our group members consist of three people, which are me, Gayatri Lichumanan, Durkashana Vashani, and also Devyani Anaprapuan Armugam. I'm gonna talk about objective and introduction. First, objective. First objective is to understand the role of specific fecal short-chain fatty acid as indicators of gut microbial activity and composition. This will determine which species of gut bacteria are present and which are active used in short-chain fatty acid levels. We can also differentiate short-chain fatty acid, provide information on gut microbial function and balance. Second objective is to identify fecal occult blood as a sign of inflammation or bleeding in gastrointestinal tract. This will determine whether iron blood is due to the diverticulosis, IBD, PLOPs, malignancy, or ulcers. The digestive system may bleed internally as a result of certain common disorders. The third objective is to discover early symptoms of gut related disorders utilizing non invasive diagnosis methods, which are occult blood tests and short chain fatty acid analysis are helpful for early management because they can identify changes in gut health early on and frequently before symptoms worsen. Next is introduction. Gut health is very important for well-being since it influences digestion, immunity, and metabolic functions. Disturbance in gut environment, such as microbiome imbalance or intentional lining damage, have been related to a variety of gastrointestinal and metabolic illness, including obesity, diabetes, inflammatory bowel disease (IBD), and colorectal cancer. The study of fecal short-chain fatty acid and fecal occult blood test are two key non-invasive methods for assessing gut health. Let's move on to the definition for SFS, short-chain fatty acid and fecal occult blood. Short-chain fatty acids are created by a gut bacteria during the fermentation of dietary fiber. They are important markers of intestinal function and biochemical activity. Fecal occult blood testing detect blood in the stool, which can indicate mucosal injury, gastrointestinal bleeding, or the early stage of colon cancer. Occult betas and fecal short-chain fatty acids profiling offer important information on systemic metabolic state and gut health. Next, I will pass my presentation to Devyani.
Okay. Good. 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 Good day, Mr. Kwan Jae-won. Today, this is a methodology of patient for preparing the facial procedure clinical sampling. So, firstly, first step is to patient the prepare and constant. Walk the patient through the process. It's a goal and sample collection techniques. Obtain information consent and educate the patient on refining the from the consuming NSAIDs, red meat, and vitamin C 3 days prior to occupied blood testing. Secondly, sample collection. Provide label and certified container for facial sample collection to each individual patient. Instruct patient to capture the middle part of the stool of the specimen and ensuring no cross-contamination with urine or water occurs. Verify the samples actually sealed and labeled appropriately with ID, date, time of collection alongside specimen type. Thirdly, transport and storage. In case immediate process is not possible, store sample at 4 degrees Celsius. For short chain fatty acid analysis, samples should be processed for to 6 hours or stored in 8 -80 degrees Celsius for long-term storage to preserve microbial metabolism. Fourthly, facial SCFA analysis. Butyrate acetate propionate. Weighed out at approximately half a gram of stool sample, homogeneous in distilled water or buffer, certified, then extract supernated, analyzed using gas chromatography with flame ionization detection. Report concentration of butyrate acetate and propionate in micromole per gram facies. Lastly, facial acute blood test IFOBP method, which is using small tools provided transferring a portion of stool into designing test cards or tubes as indicated by specific kits used. The kit instruction should be followed for incubation and develop process.
Next, I am going to explain about target output by different methods. The first method, spectrophotometry. Spectrophotometry measures colors due to chemical change between hemoglobin and chromogen. It absorbs optical bands at specific wavelength, and it has also qualitative, which also measures positive and negative with low, moderate, high blood. Second is HPLC, high performance liquid chromatography. This separates and quantifies SCFAs based on their chemical properties. For example, retention time and peak area. And it also measures concentration in mmol. Third, ELISA, enzyme-linked immunosorbent assay. This is the antibodies bind the target enzyme labeled secondary antibodies generates a color change. For example, optical density at 450 nm for the most basic ELISA kit. And it also has quantitative values in ngl/ml or microgram pieces. Last is biosensor. Biosensor converts a biological reaction, for example, enzyme substrate, into an electrical or optical signal. It also gives currents, voltage, and also color intensity. It also often gives real-time quantitative data in mole millivoltage, and also microvoltage. Next is effect on well-being in organism. Gut and digestive health. First thing is gut and digestive health. Butyrate strengthens the intestinal barrier, preventing leaky gut that allows toxins into the bloodstream. SCFA reduces gut inflammation, protecting against IBD, which is Crohn's disease, ulcerative colitis. Second, nervous system and mental health. SCFAs influence the gut-brain axis, affecting mood, coordination, and stress response. Diagnose and low SCFAs are linked with anxiety, depression, autism, and also Alzheimer's. Third, immune system modulation. SCFAs promote regulatory T cells that suppress inflammation. They also help balance autoimmune response and reduce allergic risk. That's all from us. Thank you for listening. ஐயோ, ஏன்னா pronunciation வர மாட்டேங்குது, ஒண்ணுமே வர மாட்டேங்குது.